Thursday Thoughts. Thank you for joining us. Dr. Wegerif here at Pure Plastic Surgery. Hope everybody's having a great week. For those of you in South Florida, we've had some wild weather over the last few days. But today I'm going to talk about liposuction, 360, liposculpture, and BBL. Kind of what we can accomplish with each one of those tools alone and in combination with each other. Get into who's a good candidate for this and what other procedures might be needed to really optimize your results. So we get a lot of questions sometimes, especially with our before and after pictures, with patients asking what some of my previous patients have had done. So I'm going to go through some of these pictures and we're going to talk about what these patients have had done and what is actually possible with either just liposuction alone or liposuction with fat grafting or BBL. So we'll go over some of that now, and I'm going to kind of see, what you guys think this patient had. Looking at this, you think this is lipo 360 and a BBL, or just lipo 360? And since I'm not looking at the screen, I'm going to just tell you that this is lipo 360 and a BBL, or kind of what we call a skinny BBL. This is a subtle improvement of her curves, but she had a little bit of dimpling and stuff. The fat grafting really helped smooth out that. But a lot of the shape actually comes from the liposculpture. When we're able to shave down the lower flanks is what really gets us a lot of shape. So I'm going to show some other patients that, a lot of people ask if this patient had a BBL. This patient did not have a BBL. This is liposuction alone. Again, keep in mind, these are younger patients with really good skin quality that are going to get a lot of skin tightening. But she got a phenomenal result with just liposuction alone. And so it is possible, certain patients don't want to put up with the recovery protocols that are required for a BBL, which includes staying off your butt for at least 2 weeks, sleeping on your stomach. Some patients just can't tolerate that. And if they have the good underlying architecture, we can just do liposculpture alone and really actually get a lot of shape to your buttock just from doing liposculpture. Just by smoothing out these flanks and carving out that upper curvature of the butt, you can get a great look just from liposuction alone. Fat grafting is obviously a great tool. I love it. We do a lot of it. We do it all very safely with ultrasound guidance, but one of the things to keep in mind, especially if you have a good butt to begin with and you just need a little extra, we can do liposuction alone. This is another patient. This is a patient that I was actually kind of shocked how good of a result she had. She had quite a bit of fullness of her lower abdomen. I really tried to push her towards an abdominoplasty. She just did not want to do it. So I would say this is kind of an atypical result, and I don't have a side profile of her right now, but I'll get one of those and post it to my Instagram soon. She ended up getting a phenomenal result without actually needing an abdominoplasty. So if you're a young patient with great skin quality, meaning no stretch marks, less than 30 years old, it's possible to get amazing results with liposculpture alone. But a lot of patients in this patient's scenario typically would have had enough loose skin at the end of the procedure to really warrant an abdominoplasty. Luckily, she was able to contract and did really well. So that's another thing to keep in mind whenever we offer these procedures. A big part of getting the optimal result is your recovery process and what you're putting into it. So for patients that are getting a BBL, that means staying off of that butt so your fat can reestablish a blood supply and survive long term. If you don't do that, you're going to be really disappointed with your result because a lot of your fat's going to die and you're not going to get that result you were looking for. And with all the patients for the liposuction, the lipo 360, you really need to be diligent about wearing the garments that we give you and recommend you wearing, and then also getting your lymphatic massages. You need to trust the process. Immediately after surgery, you are going to see results, but you're not going to see final results till weeks down the line. And to optimize those results, you really need to get the lymphatic massages. 20 plus lymphatic massages is going to make such a world of difference in your overall result if you really trust the process and put in the work that you need to put in to get the best result you can. All right, do we have any questions?
So far, not yet. Do you have any other questions? I think we did have a few.
Yeah, so I got Question from our question box that we posted earlier. It was asking what inspired me to become a plastic surgeon. This is always an interesting question, and I actually had a few different career paths I had in mind at one point, but when I decided to go into medicine, I knew for sure I wanted to be a surgeon. And then the question is, what kind of surgeon do you want to be? I love working with my hands, so that's what led me to surgery. But what led me to plastic surgery is just our ability to work all over the body. Throughout my training, I did full general surgery and then my plastic and reconstructive fellowship. So I work from head to toe, literally with every other specialty. Plastic surgeons are the surgeons. We help other surgeons, complete their tasks in reconstruction, and that's the thing that's really interesting about this field and gives you such a breadth of understanding of the human body.
Interesting. Now, you have a long history then for so many years. Now, what is your favorite surgical procedure you performed in the OR?
So this is always a difficult question, and I feel like most surgeons probably think this is a difficult question because, especially what I just said about plastic surgery, we do so many different procedures and get to do so many different things. It's hard to really choose a favorite, but in cosmetic plastic surgery, or what I'm doing most of the time from day to day at this point in my career, I think mommy makeovers are super profound just because, a mommy makeover is a combination of surgeries which includes breast and tummy typically. We can add on other things like arms and stuff too, but it's just really patients walk in with one body and walk out the door with another, and they just have a profound effect from that. So I love those procedures. I also love the liposculpture and BBLs just because it's really refining the natural curves that you have, and that's where a lot of artistry comes into the job.
Interesting. Now, going into inspiration, do you think you'll inspire your kids one day to become a plastic surgeon?
My kids? I don't know. That's a tough question. They would really need to show a strong interest for me to encourage them to do it because it is a really long road, and there's probably other careers out there that would be equally as fulfilling with some less heartache. So you really need to be dedicated to it and love it to want to pursue it for the training that's required.
Okay, thank you for the question. And someone's asking from TikTok, where are you located? How can we get a hold of you?
Miami, Florida, at pureplasticsurgery.com. Please find us on the website. You can find me there. If you are interested in a consultation, there's a link right on that first page that you fill out a little questionnaire and we'll get the process started. Consultation is free right now for me, so come talk to me. Happy to talk to you.
Alright, that's all the questions I have for you. Do you have anything else on mind before you want to?
That's it. I hope everybody has a great weekend, and I'll talk to you soon.